Hello everyone, it's Dr. Gupta at the Dermatology Laser and Vein Center, and today I'm going to show you one of our most popular, most common procedures we do here, which is taking care of unwanted veins. We can take care of them on any part of your body, including the face. Hands are very common as well, and then we also get them sometimes on the chest and other parts of the body, but of course the most common area are the legs, and these are fairly common. A lot of women have spider veins or varicose veins on their legs. They're often an inherited sort of tendency, but they can be made worse by standing on your legs a lot without proper support. They can be made worse by weight gain, and of course pregnancy also puts a lot of pressure on the vascular system and can cause those valves within the veins to get weaker, and then the blood, instead of flowing upwards, starts to just stagnate in the vessels, and then you can see visible veins that start appearing in the legs. So taking care of the veins does make obviously the appearance of the legs better, but it can also make the legs feel better, because sometimes the veins can be achy or they may feel a little bit dull in sensation. You might even feel a little bit of numbness, or sometimes patients complain of itching or getting cramps in their legs. And so alleviating the vessels also alleviates the symptoms a lot of times with it, which is really nice. And it does actually overall improve the health of the vein, of the vascular system, and of your legs long term. So if left untreated, sometimes you can, if they get really bad, get like venous ulcerations and things like that. Or you can get swelling in your legs and so on. So obviously we don't want to treat all the veins. We're just working on the superficial vessels that are visible on the superficial system, and it's perfectly safe to treat them. The worst side effects after the procedure are usually bruising. And then sometimes as the veins are dying off, they can sort of leave a shadow of themselves for a while, because the blood that's trapped in some of the larger veins may actually oxidize as it leaks into the skin out of those dead vessels, and then cause sort of a brownish stain. But it goes away, and then there are some creams that can be used, or we can laser those off if that happens. But that's pretty rare. You know, most of the time the veins just disappear and go away. I would say usually 50 to 70% of the veins that I treat on the first go completely disappear. Some of the survivors may have to be retreated. So it can take a few sessions to clear up the veins completely, sometimes up to 3 visits total. And then periodically you have to come in to maintain. This patient had her veins treated about 5 years ago, had a beautiful response, but now she's redeveloped some veins, because that's just in her tendency to kind of make these veins. So we just stay on top of them and keep your legs looking good and also feeling good. All right, so we're going to go ahead and do the treatment. We're going to use foam sclerotherapy today. We can use hypertonic saline. We can also use this polydocanol or sotradecol foam, which also works really well, and it's kind of just fun to watch the veins disappear. It's really gratifying.